as we do our first annual meeting for the Valve Symposium, we'll do a yearly symposium kind of updating on the aspects of the valve disease. I thought we would just start off. David gave you a very nice overview, kind of where our entire structure is, but I want to just let you know that we have, of the 19 hospitals, 3 of them, actually 4 do heart surgery, but really 3 do TAVR MitraClip type of procedures and higher end surgery and transcatheter valve. And I wanted to kind of highlight all of those because I think it's a phenomenal place. As far as cardiac surgery goes, we now have 15 partners who do heart surgery in the 3 hospitals, soon to be 4. And we have a team here in Augusta. We have a team in Athens who do these high-end structural heart disease procedures, surgery and transcatheter. And we have a team here in Atlanta, Jim Stewart on the upper right being the most recent addition to the structural IC program. And we just have an absolutely phenomenal APPs and providers and nurses that kind of, and nurse navigators who keep all of the processes going. Just a little couple of things about the program. Our TAVR program is now the largest in the Southeast. We do over 750 TAVRs a year now, roughly 500 to 550 in this facility, and just north of 100 in Athens and Augusta. We now are the largest mitral tricuspid transcatheter program in the Southeast with over 160 valve implants. So when you look at our system, we're doing almost 900 catheter valves a year, which puts us within just 3 or 4 programs in the United States doing this. Of course, this does not include the surgical volume, which I thought we would just leave out of today's slide set, but it obviously is well over 1,000 valves a year being done. Commercially, in our 3 programs that we have the top 3 commercial valves, but we also have 3 research valves that we're doing, and we'll talk a little bit about that. For mitral regurgitation, we have a lot of a toolbox. Obviously, this slide is not meant for you to read, but when a patient comes to the program, this is what they don't say, oh, you're going to go just get mitral valve surgery or this or that. This is what they have availability to. And this is our toolbox, what we call for primary MR. And then mainly for this is something that we do, which we love. This is my favorite, personally, my favorite operation that I do is a minimally invasive mitral valve surgery. Here's just one representative patient, Rick Harvey, who's also in the group, who's going to be soon joining the Macon program. Rick and I do the whole program does mitral valve repairs. Rick and I are the only 2 that do minimally invasive mitral valve surgery. He'll be at Macon starting March the 27th, and I'm here in the Atlanta hospital. And Jim Cowton also is here, who does a lot of mitral valve repairs. For secondary mitral regurgitation, a whole nother slide set. So it's really, in my mind, and I see what's happening in the country, we have probably the largest toolbox for primary and secondary MR in the United States. For those of you, research is really important, and I know some of you have your patients are a part of this, and we appreciate that. We are now doing 27 valve studies here at Piedmont. We are the first in the Southeast, and we're top 10 in the U.S. for the type of valves researches that we do. We're not just doing research. You can see here we are either on the steering committee of the national PI between our attendings for all of these valve trials, which just puts us probably in the top 2 or 3 programs in the United States where we're doing actually running trials, not just participating in them. David had mentioned to you just 2 recent papers we had, New England Journal of Medicine, but when you look at 2021 and 2022, just the Valve Center, not PHI, will publish 160 peer-reviewed articles in a 2-year time period. So this is really important to us, and academics is very important to us. So just some team accomplishments overall. I'm not going to go through these, but it's something that we're proud of, not just at the Atlanta hospital, but also in the Augusta and the Athens and soon to be Macon valve program. So really happy about some of this stuff. So we appreciate your support. I do want to tell you that we have a weekly conference on Thursday and Friday morning. They're virtual. So if you have a patient that you want to talk about yourself and present, we're happy to send you the link, and you'll be able to do that virtually with us. On that, we have the entire echo team, the CT team, the interventional cardiology team, and the cardiac surgery team. So there are 4 disciplines, including the valve coordinators and the APPs. So there are 4 physician disciplines on every call. So we'd love for you to be a part of that. If you want, just text Pradeep or myself or anybody else that you know on the valve team that can get you through that. So thank you for coming today in our first meeting. We look forward to this growing into really a regional meeting over the next couple of years, just dedicated for one day on valve disease.